Hello everyone, I think that's my cue to start. So my name is Sophie Hawksworth and I'm a Senior Research Manager at the Wellcome Trust, which is one of the funders of the UK Prevention Research Partnership, which this webinar series is highlighting. So it's a real pleasure to welcome so many of you to the webinar today, and I'm looking forward to hearing some really interesting discussions. So thank you for joining us. So first, some quick housekeeping points. Please note that this meeting is being recorded. Please can you keep your cameras off and yourself on mute? This allows us to do a better recording of the meeting. Please can we ask you to submit questions via Slido, and the code is here and will also be in the text conversation. That way it's easier to kind of keep track of the questions that are coming in, and you can add questions any time during the meeting, and we'll have a question and answer session at the end. There are closed captioning options available, which you can find in the stream text link in the chat box. And then if you have any technical questions, then please contact our webinar support team, and the email is there. Great, so next slide, please. So this is the agenda for today. I'm going to give a very brief introduction. Then I'm going to pass on to Julian Cox, who will talk about the Cipher Research Consortium, which is one of the UK PRP consortia. And then after Julian's talk, we'll have a talk from Greg Fell, who's Director of Public Health at Sheffield City Council. And then, as I say, a general Q&A and discussion session, and then I will wrap up and we will be done in an hour. So a lot to get through, but hopefully really rich conversation. So before we start properly, I just wanted to give a quick introduction to the UK PRP so that you get a sense of what this research programme is about. This is a £55 million initiative backed by 12 UK funders, and you can see the range of funders listed here. And we're trying to do something very different in public health funding by focusing on common upstream factors with prevention within complex systems. There's also a clear focus on producing actionable evidence, and as part of that, co-producing research with the users of evidence, such as local governments, which is why I'm delighted that Greg will be bringing that perspective today. Next slide, thank you. So the first round of UK PRP awards were funded in 2019, and they include 4 large multidisciplinary consortia we can see on the top line here, which cover a range of topics. And today we're hearing from the Cipher consortium, but you can read about the other groups on the UK PRP website, and there will also be other webinar sessions, which I will highlight at the end. In addition to the large consortia, UK PRP funding supports 4 smaller networks to build new communities of researchers and users around a broad NCD prevention agenda, and those are listed at the bottom of the slide. Next slide, please. So the second round of UK PRP funding was announced this year and supports 3 new consortia to add to our portfolio, and we hope to be able to highlight their work at a later date as well. Next slide, please. So today's session is really focusing on complex systems and systems approaches in public health. And this is the second in a series of 4 which we are running over the autumn. And we're trying to highlight the emerging learning from the first round of UK PRP funded projects. As I said, I'll detail the other webinars at the end of this event. So just to kind of set the context a bit, as I'm sure we're all aware, the conditions in which we are born, grow, live and work are key drivers of health and inequalities. And preventing ill health related to these wider determinants of health requires well-coordinated policies across many sectors, not just those that fall traditionally within health. Next slide, please. So we'll be exploring how system science approaches can provide valuable evidence about the consequences of policy decisions upon health and health inequalities. The Cipher consortium is working to deliver new evidence of the results of policy decisions in 4 areas: inclusive economic growth, adverse childhood experiences, housing and mental health. And speakers from Cipher will today be sharing some emerging findings and their implications for policy. So without further ado, I'm going to pass over to Julian to tell you more information, and just another reminder to please put questions on the Slido webpage. Thank you.
Thanks, Sophie, and thanks everyone for joining us today. It's a great turnout. I'll just pull my slides up. Hopefully you can see those now, and just introduce myself. So I'm Julian Cox. I'm Assistant Director of Research at the Greater Manchester Combined Authority, and so we are one of the members of the Cipher consortium, which Sophie just mentioned was one of the initial 4 UK PRP funded consortium projects. And we're really around system science and how we can use system science to influence decision making and improve health and well-being by giving decision makers the tools to apply evidence in their programs to improve health and reduce health inequalities. So I'm going to talk through the sort of science we're creating in the Cipher consortium, and take you through what we're trying to achieve. So started 2 years ago, and we're getting to the point now where we're getting some outputs to be created, which are really exciting, and hope we can continue to make lots of really good progress over this year. And you can see there we've got 7 university partners and 3 policy partners, and the policy partners aspect is really important to this consortium because it's a real co-produced program of work, and we've got 3 individual areas we're looking at. So there's Sheffield City Council, Greater Manchester Combined Authority, which is where I'm from, and then we've got the Scottish Government. So we're getting a city level, a sort of city region level, and a nation level partner to support the programme. And there we go. So what is system science and what we're trying to do with the programme? Well, system science is really thinking of the overall environment that people live in, and not just looking at individual interventions, but thinking about suites of interventions, thinking about the environmental factors, other sort of impacts on people's lives that we need to take into account when we're understanding how outcomes change, how systems change, and what the best way of then sort of supporting that system to guide it in the right direction so we can improve outcomes for people. So all the policy partners have a strategic vision for the future, which they're trying to then use the relatively limited funding they have to change. But how do we best do that, and how do we get the science to support that and feed into that decision-making process? And you can see along the bottom it's quite a multidisciplinary area. We've got a whole range of academic disciplines supporting it. So from a qualitative disciplines, thinking about the social science and talking to people about how they make decisions, what the topic areas are, and how those are sort of panning out in the local areas, and really understanding how we might then sort of influence decision makers to think differently about using evidence and changing their policy making. Then we've got some sort of more quantitative data science aspects, ensuring we have the right data and the right tools to use. Then modelling that data and understanding change in the system and how things move around and the relationships between different parts of the system. When we do sort of decision making, there's obviously trade-offs that are required. We never have enough money to do everything we'd like to do, so we need to understand what the most impactful decisions might be. So we need to really be able to understand how we can compare different types of outcomes, whether they're health or economic or well-being outcomes, for example. How do people trade those off, and how does that help our decision making? And then we have to have a way of bringing it all together so that people can actually take that science and use it in real life. So we've got system engineering colleagues supporting us with creating tools that we can then use to demonstrate how changes that we might make might impact on the overall system. So I mentioned the 3 policy partners right at the start, because they are really important, and co-production is key for this project. It is a very interactive project between academia and policymakers, So I'm really excited to be part of this project. I'm a co-director of the project. We've also then got embedded researchers in each of the 3 policy partners, and they are full-time embedded researchers whose role is to provide information, data, evidence to the academics, but also to ensure that whatever the academics are creating is actually useful for local or national government, to make sure those tools actually can have an impact. And we are focused on the partners' priorities, so these have been developed by individual partners, and we're all looking initially at inclusive economy because that's a key element for all 3 partners. And even since we started, it's getting more and more important in terms of things like the levelling up agenda that's now being talked a lot about, and how that relates to inclusive economy. We also have a group of other people that are advising us to make sure we can achieve what we set out to achieve. And the one I'm going to talk about today is just on the bottom right, which is probably the most important one, which is our community panels. So we have a community panel in each of the 3 policy areas, and they meet every 6 months, and they review what we're doing and challenge it, and hopefully they can keep us grounded in our research to make sure that we're not off in our ivory tower, not taking account of the real world, and making sure what we are creating is actually going to influence people's lives. That's really important to us. So I'm now going to go and talk in a bit more detail about all the different elements of Cipher and how it comes together. And this diagram is the Cipher wheel, which links in the different work strands, and I'll very briefly talk about it here, but then I'm going to go into more detail and show you some of the outputs from the individual bits. So at the top we've got work strand 1, which is how we really understand as a consortium what policy processes are in different areas, what the needs are of decision makers. There's quite a lot of interviews that have gone on in that work strand. Then we're moving around the wheel, we've got work strands 2 and 3, which are bringing together both evidence that we can collate and also all the data that we have on in this first topic, inclusive economies and people who live in the 3 areas. We're then looking to model that data and see how things change. So we're doing some dynamic modeling and simulation work to think about interventions and what that might do to the system. The economics element is work strand 6. That's the trade-offs and asking members of the public their opinion on their priorities across different types of outcome. And then finally bringing it together into tools, which is work strand 7, which creates a decision support system for people to use. Alongside this, we have our evaluation work strand, which is both saying whether the system science approach is going to work for this these topics. So is it the right approach to do to really understand a system and make some change? But also really interested in understanding the academic policymaker relationship and how that works, and whether that's a useful model for future types of research as well. We're going in a little bit more detail about each of these. So the first one, work strand 1, qualitative, mostly qualitative policy systems work. So there's been a number of interviews with decision makers across all 3 areas, really trying to understand what people mean by inclusive economy or inclusive growth, which it varies across different areas, and actually that's one of the benefits of the term, is it can mean lots of things to lots of different people, so it's quite a useful badge for lots of things. That also makes it very complicated when we're trying to map it. So we do need to then try and think about that system, and the systems mapping element has been a lot of the work in this work strand. So in each of the areas we have held workshops to identify how people in those areas see things linking together. So whether it's from a strategy to an intervention or to an outcome, how do those different nodes on these systems map actually interrelate? Where are the strong linkages? Where are the feedback loops? And how does the system all fit together? So we created 3 of those. You can see the pictograms of them on the left-hand side there. And you see they all look slightly different. So we did them for Great Manchester, for Sheffield, and for Scotland, we just chose a smaller area, chose just Clackmannanshire, but we've got in total over 700 nodes and over 2,000 links. So in order to use these in the models for Cipher, we have to then simplify those in some way. So we've done a lot of work to aggregate those into a single map, and then we've broken those down even further into different categories. So clusters of nodes, and you can see an example there of the economy cluster. And that means we can now get into a bit more detail on that individual cluster and sort of break it down into a small enough chunk that we can really do some modeling on it. And then we'll be joining these all back up together. So some of the other clusters like place or environment we'll be bringing back together again. And then to understand how we get the sort of evidence base behind all those linkages, we've done work around synthesizing that evidence base. So we've work strand 2 is all around collating that evidence. So the academic evidence, there's a lot of it out there. How do we pull it together so we can use that to sort of support us when we trying to understand the effect sizes and some of those relationships that we had on the systems map, or types of policy that might be useful for furthering sort of inclusive economies. So we've done a big review of synthetic reviews, or an umbrella review at high level, taking all the systematic reviews that can be found around one of the key aspects of inclusive economy, which is a relationship between work and health. And so we've got a raft of information there that's been brought together, and so the team have been thinking about how we best use that, how we best present that for other people in Cipher and elsewhere as well. And what they've come up with is an evidence gap map, which is a nice way of visualizing all that data. And you might not be able to read the words along the side or along the top here, but just to explain, we've got on the left-hand side different types of either work or work situations. So whether people are in work or out of work, whether they've got long hours or insecure work, or shift work, for example, which is a very small element of some of the domains there. And then along the top, we've got different outcome measures, whether it's physical health or mental health, and breaking that down into different areas. And we've then looked at each of those systematic reviews that's color-coded in terms of the strength of the systematic review. And you can see there are some squares on the matrix here where we've got gaps, and that means that there isn't a systematic review which links those two parts of the matrix together. So that means we might need to do a bit more delving, and there might be that there is evidence there, but it's just not in a systematic review. And so if we need that for the map, we either need to do new research or we need to do more delving. But contrary to that, there are some areas which we've got really strong evidence, like this one here, which is the general link between employment and people's general health. And there's lots of information there we can use in our modelling. And this gap map enables us now to then look in more detail and get a synopsis of each of those elements of the systematic reviews, and gives a short way of understanding that, so we can use it in the modelling. Now, this evidence gap map, we like all the tools we're creating in Cipher, we'll be making it public for anybody to use, and we're hoping to have this one ready to go on the Cipher website in the next couple of months. So look out for that, because I think it'll be useful to lots of people, not just those within Cipher. So moving on to more the data side of things. So we've got work strand 3, which is around getting the data infrastructure in place and pulling that data together. One of the key things that's been developed here is a synthetic population. And this is by combining different data sets, especially the census and understanding society data. We've then been able to create a very small geographies populations which aren't exactly the same as the people living in Greater Manchester or Sheffield or Scotland, but are have equivalent attributes, and we can then use that for modelling purposes. So it allows us to disaggregate some of the data we have, which quite often is only reported at maybe local authority level, into much smaller geographies that we can use it for modelling purposes, or for other reasons like targeting investment, for example. moving on to the modelling side of things, we've got two levels of modelling. The first one is a top-down, high-level system dynamics modelling, where we're taking data and other evidence to try and understand the sort of macro level relationships between outcomes and be able to do that, to create models and dynamically forecast into the future. So that's the first one, and then we'll be following on with actually doing that at a much more narrow micro scale. So taking the synthetic population and those people in that population, thinking about how we see what might happen to those individuals or those small geographies or demographic groups in that population if we make changes through interventions. Work strand 6 is the trade-offs work strand, and lots of work here to run experiments with members of the public to understand their preferences. So we've done one round of that to try and understand how people would trade off different types of well-being, and we've based that on what we call the Cipher 7, which is breaking down sort of well-being as it might relate to inclusive economies into 7 different attributes, and then they all have different levels of how good an outcome it is for each of those attributes. And from that, we have potentially up to 20,000 different combinations that people could choose, and people have been asked then to compare and contrast some of those different attributes and doing sort of choice experiments so that we now understand how people in general value each of those compared to each other. And that allows us to then create what we call an equivalent income figure, which means that someone might have a sort of high income but low health, and that will therefore be sort of that combination might be relatively low equivalent income compared to someone who had good health and good income. Vice versa, people might have very low income but very high health, and that would be still a good state to be in. So from that, we can then use that to do some of those trade-offs, and when we're seeing changes for people in society, how do we value those and compare them? The decision support tool then tries to take those trade-offs and all the other data we've got and put it into a visualization and for people to use. And this is the very first stage we have of visualization, taking that data from both the surveys and the synthetic population, and then trying to do some currently some quite sort of high level assumption based interventions, thinking about, in this case, this is Sheffield, looking at MSOAs in Sheffield and how we might intervene. And it's interesting about different trade-offs you might have to make at a high level as well. So got 2 maps there. One is where we think the interventions would be maximising the overall improvement in outcomes and that equivalent income figure for members of the public in Sheffield. And then the other one is actually minimising the inequalities across Sheffield by doing a different set of interventions. There may well be some win-wins across both of those, but it's important to really understand when we are making interventions what's happening to inequalities as well as the overall improvement in outcomes. Very briefly, just mention the work strand 8. So this is around that evaluation. So is the co-production between the policy partners and the academics adding extra value? How are we getting decision-making practice changing in the different policy partners? And is this a way of helping decision makers make better decisions that they can engage with and use? So briefly bringing it back all together again, and these are the sort of key outputs we aim to achieve, which again, I say a lot of these will be available soon, and we will make everything available at the end of the project. So we've got some qualitative research on policymaking, which there's already papers been written on there. The synthetic populations will, once we've tested them properly in the 3 areas, we'll be sharing those, and that synthetic population is actually available at a UK level, so it's not just in the 3 areas. then the different system dynamics models will be available to people when we've created them and checked them. The valuations will be also, we've got another round of experiments, partly because the first one we did was during COVID and we want to make sure that didn't skew the results. And then the tools will obviously be tested by the policy partners, and when they're ready, they'll be shared with everyone else as well. And the wider evaluation will too. So my final slide now here, this is sort of setting out what our overall impact vision is. So during this 5-year funding period, we're hoping we can achieve definitely new tools and methods to use in those consortium partners on a regular basis, and creating new evidence to help those policymakers think differently and make better decisions and hopefully have more impact. We already created new partnerships, and we're quite optimistic, but we're hoping we'll see some sort of early effects on the causes of health, maybe not the impact on non-communicable disease in total, but some of the early proxy measures that will show us that we're heading in the right direction by the end of the 5-year period. And then following on from that, we want to take this further and make these methods more available to a wider group of researchers and policymakers to make sure that we can have that wider impact. Long term, obviously, we've got the similar aims to those of UK PRP as a whole, getting cost-effective solutions delivered at scale to reduce disease burden and health inequalities, and also at the same time trying to improve productivity and generally improve lives of all people in the areas we work in. So that's it for me. I'll hand over to Greg now to give a more general local authority viewpoint, and I'm looking forward to questions in a little while.
Thank you so much, Julian. That was a very comprehensive description of such a complex project. That was fantastic. Just before I pass on to Greg, a quick reminder to please add your questions to the Slido link, and then we can have a question and answer session at the end. Right, over to you, Greg. Thank you very much.
Thanks, Sophie. Thanks all for attending. I'm Greg Fell, Director of Public Health in Sheffield, Secretary of ADPH and Cipher collaborator. I'm a co-investigator on Cipher. Julian's done an amazing job, so I won't talk much about Cipher at all. I'm going to talk about policy challenges and implications within the local authority sector. You'll be pleased or horrified to know that I am not going to talk to slides. There's a speaking note which Sophie's got, and I'm happy that that's circulated, which covers what I'll talk about, but I'm not going to talk to slides. And I'm going to give you quite a blunt and quite an honest view of the context in which some of this is playing out from a local authority perspective. So apologies for bluntness in advance, but it's important I speak honestly. So firstly, what do I care about as a Director of Public Health in a medium-sized city in the north? At the moment, COVID and only COVID. And I won't talk much about COVID today, be pleased to know, but most directors of public health have done nothing, literally nothing else for the last 20 or so months. That will come to an end at some point, I hope, before we all fall over. So in peacetime, the thing I care most about is the gap in healthy life expectancy between affluent, deprived, black, white, disabled, not disabled, however you want to cut that gap, and there are multiple ways of cutting it. That's the thing that most directors of public health care most about. For me, in Sheffield, we can all talk about the size of our gap. For me, Sheffield at its extremes is about 20 years. So a man born in Darnall, which is one of the more deprived parts of Sheffield, will expect to live about a third of a shorter life in a state of poor health. A man born in Carternole and Dore can expect to live about a seventh of his life, his longer life, in a state of poor health. That's the thing that matters most. And all of the things that contribute to that, which is pretty much everything that happens in Sheffield in some way, shape or form, contributes to that, to the outcome, healthy life expectancy, and the gap therein. Of course it matters for NHS and social care demand, and I won't talk much more about the NHS for the next 15 minutes. It's also a really obvious social justice issue. Who thinks it's fair? Nobody, no hands go up at that point. It's also an economic productivity issue. You got people having strokes age 52. Many of them aren't going to go back to work. That affects economic productivity. It also directly affects sort of poverty and the financial security at individual and family level for all sorts of obvious reasons. So I've been told a number of times about a piece of work that was done in Scotland, I think, which kind of looked at the constraints to economic growth. Skills was understandably number one. Second was health. Or lack of it. And the third one was caring responsibility. So the stuff that carers do, often secondary to health or ill health and or disability, much of which is avoidable. So I frame health in that context very, very deliberately and don't frame it in an NHS social care, NHS and social care context. So that's what I care about. What do local authorities care about? My masters, bluntly, not going bankrupt. Survival is the thing of the moment. Most local authorities are in a very, very, very difficult position financially. Social care demand, both children's and adults, is levels of financial and clinical risk that's at eye-watering levels. You know, I can't underscore that enough. That's the thing that arguably matters most. Second thing that matters most to local authority, or third thing, one is going bankrupt and survival. Second is social care demand. And thirdly is economy and jobs and social and economic recovery from COVID. It has been the defining event of our lifetimes, probably. I hope it's the defining event of our lifetimes. I don't want to see anything bigger than this. It will have a long social and economic hangover that will probably last for generations, and local authorities are going to have a big role in that social and economic recovery. But where most of us are right now, 11 years of austerity has had a huge bearing on service delivery across every aspect of every local authority. And if you think what local authorities are responsible for, yes, social care, obviously, but planning, housing, culture, leisure, transport, the things that we call the social determinants of health, that's where many of the interventions are held responsible locally. So 11 years of austerity has had an impact on that one. So the things that I care about from with my corporate hat on, our ability to deliver services that in effect influence the social determinants of health, the social risks for poor health, and our ability to engage with evidence is limited in that context, and it's important I'm honest about that one. So going into the pandemic, we had a very, very hollowed out public sector. It's 50% smaller than it was a decade ago, 50%, and the welfare system similarly. So for Sheffield, our spending power, our annual spending power, is about £900 per person less than it was in 2010-11. So doing the maths, that's about £500 million less in operating revenue to deliver the services that we deliver. Obviously, that has a big bearing. The bits of the authority, and every authority is in the same boat on this, that have taken the brunt. Planning, 60% cut, housing, 50% cut, culture and leisure, 50% cut, transport, 40%. Imagine running your operation with your operating budget halved. That is the thing that most of us care most about right now. A few authorities are in serious trouble. A few are very, very close to the edge. What we've seen to date is sort of deals done with individual councils from the Whitehall government to avoid them going bankrupt, because no one thinks that local authorities going bankrupt is a good thing. So we've tended to see deals that are done authority by authority rather than addressing the structural underlying deficits, because that will be a difficult job for the Whitehall government for obvious financial reasons. Why does it also matter? The impact of all of that has had a huge bearing on life expectancy and healthy life expectancy. 3 pieces of critical evidence. One was Marmot's 10 years on report, which was published in February last year. Spectacularly bad timing, given that the global pandemic was just kicking off then. Second was the stuff that Ben Barr and others have been publishing recently, and I can find some links and put them in the chat if you need to. And thirdly, there was a piece of evidence from Lancet Public Health about a month ago, which again directly attributed the local authority financial position to the long-term drift downwards in historic improvements in life expectancy and healthy life expectancy. So I've talked about money. I won't talk much more about that one. Now I'll talk about health. So health is probably a minority sport in local governments. Most of us do health by stealth. Arguably, the point of local government is health, given all of the things local authorities are responsible for. But most people in local authorities think health equals the NHS, and we worry a lot about ICSs and the development of ICSs, etc. Do we really worry about the health consequences of our decisions in housing or transport or economic policy? Well, yes, we do, but probably not front and centre when we're making the decisions. So there's a lot of influencing by stealth and influencing by circuitous routes, aka me reframing health as an economic productivity issue, which it absolutely is, and local authorities do care about that a lot. Who gets sacked for the gap in healthy life expectancy? Who's accountable for it? Nobody. And that's the tricky thing. Arguably, we'll then look at the floor and most people then point at me, which is fine. I'm happy to accept accountability for it, but I don't have control over all of the levers that I probably need. What I will get sacked for is when a screening program or a vaccination program goes wrong. Probably should be sacked or held accountable for not resolving the health gap. And that's a critical thing, getting that understanding deeply embedded culturally within an organisation. I've talked to you a little bit about the organisation's the sector's financial constraints, and that has a big bearing on how we see things. So that's a critical thing. Poverty is obviously, arguably, the determinant of health, if that makes sense. Land poverty in, say, obesity. I might talk about gambling a little bit as well. So even when we get advertising bans in place of high fat, high sugar food, or junk food as it's more commonly known, there'll still be buy one, get one frees, and there'll still be sort of a price differential on cheap ultra processed food versus more expensive wholesome food, etc. Poverty has a bearing on our ability to make healthy food choices. You got a fiver to feed yourself and your kids for tea, well, you're probably going to go and buy a Goodfellas pizza as opposed to a load of organic vegetables, etc. And I know I'm over-labouring that point, and I know you all know that, but it's important that we can't get away from that, and it does matter a lot. So framing work on, say, obesity in that light, again, goes without saying, but I'll say it, avoiding framing obesity in lifestyle choices and oversimplistic framing. We all do it, we've all done it, even I've done it. But it gives the wrong framework to start with. So interestingly, I'm about to do some work on problem gambling, and the gambling industry are quite keen that I raise awareness about problem gambling, which I will, but I'm going to raise awareness about the methods and tactics of the gambling industry rather than standing outside Tesco's telling people that gambling's bad for them. So get your framing right, obviously. Then there's the sort of the wider context type of territory. Sugar sweetened beverage tax, sticking with obesity, an amazing thing. Raised half of the money that it was intended to raise, and that was because drinks manufacturers repackaged, reformulated, and reprocessed. And good on them for doing it. But it raised half of what we thought it would raise, and that money did make it into local authorities, but it largely wasn't spent on the things it was intended to be spent on. School sports, for instance, it was often spent on the estate backlog. We have primary schools falling down around people, and that's not a good thing. So, we didn't anticipate some of that, and that has bearing and consequence. Lost income. There's a conversation going on in lots of authorities about banning fast food ads on clear channel hoardings up and down our high streets, etc. We probably will go there. We might go there. I hope we do. But it will lose income, and the income funds some things that we need to fund. Actually, it cross-subsidises the core council income, which helps pay for social workers, etc. So we need to get into some of that complexity. Influencing food retail. I'd love to have control over the policies of supermarkets for product placement and where they place their highly profitable, highly processed foods, but I don't. Most supermarkets will tell me to, 1, get lost, 2, talk to head office, and 3, say, well, if we do that, we'll lose profit. Are you going to recompense that profit? And no, I'm not, is the quick answer. And I have no authority to make any of that happen. So all of those things are kind of in the mix when we're kind of thinking about health. And then you get into the stuff that's way upstream of things like obesity and gambling and or things of that ilk. So the social determinants of health, the upstream things we all know, hugely important. Implementing interventions in an upstream space is more impactful, more equitable, but harder to grapple with in a tangible way, harder to see, count, and be able to measure the positive benefits of some of those things. So fuel poverty, hugely important thing at the moment. For fuel's becoming more expensive. Poverty's more prevalent than it was before the pandemic. There's a poverty thing and a thermal efficiency thing inherent in that, and obviously this has a bearing on climate too. But we need to think about the investment. Who's going to pay for the boilers and the insulation? Remember, our housing budget's 50% smaller than it was a decade ago. Then you can go even further upstream and get into economic policy, and it becomes even harder and more difficult. Often it's not about the evidence. The evidence in many of these spaces is pretty good, actually, good enough, certainly. Sometimes it's about the money. Sometimes it's about linking evidence to a whole stack of outcomes further downstream of the policy of intervention, often in a different sector, often at some point way into the future. Something about the fidelity of the interventions that we have. Do they hold fidelity to what the evidence base tells us? And stuff gets mangled by the machine along the way. We all know that. And then often kind of seeing things, we want to see things in nice, neat, simplistic ways. We all know the world doesn't exist in that way. So sometimes think beyond the evidence, sometimes use the evidence to basically have a street fight with it. Bill Gray, one of my old mentors, used to talk about street fighting with evidence, and we kind of get into that space quite often as a DPH. There's something definitively which we can all do better about tying evidence to the pointy end of demand pressure. Why should we care about alcohol? Well, alcohol leads to blood pressure leads to stroke, which leads to social care demand, the pointy end of what most authorities care about. Also, stroke leads to poverty because it leads to inability to work, family level impact on welfare system, etc. Sophie's come up on my screen, so she's staring menacingly at me. And it becomes a drain on the economy. So, somewhat points. Keeping the wheels on the bus is by far the most important thing in terms of the local authority context. The ability to deliver core policy areas, housing, economic policy, welfare, leisure, etc., etc. COVID has had a massive bearing on that one. And working through the evidence as part of a hugely complex system of what we want to do. You've all seen the Foresight report on obesity, try the same on poverty, much more complex. So all of that is in play, and all of that impacts on how we think about some of this stuff going forward in terms of the policy choices that we may or may not make. And I'm going to pause there. Sophie.
Thank you so much, Greg. Sorry for being menacing. That was a fantastic demonstration of the complexity of and the kind of difficulty of the context within which you're working. So thank you for that. We've had quite a lot of questions on Slido now, so I'm just going to we probably won't be able to deal with them all, but I'm going to pull out a few. I wondered if we could start with a question probably to both of you, but if we start with Julian, whether your aim is to identify leverage points or just multiple prevention solutions. And I guess kind of maybe when it comes to Greg, which of those is most useful from a kind of policymaker perspective?
I think it is both. So we need to understand where the biggest opportunity is in each of the topics we're doing. So for inclusive growth, is it around just getting people in good work? Is it their pay that's the key thing, or is it wider thing around skills, etc. that we might focus on? But so that's really understanding what the potential is for some aspects of interventions, and then think about then combinations of interventions which might get us in that direction. And so it's a bit of both. So I'm fudging it a bit there, but so it's that overall system as a whole. And but realistically, from a sort of a local government or national government, there is a limited amount we can do, and we are trying to sort of influence as well as intervene as well. So if we can use the science to think about the influence bit for members of the parliament themselves to do things or businesses to do things, and that's really important too.
Great, thanks. Anything to add, Greg?
So I'd say both, but if I had to pick, I'd say leverage points by actually quite a long way. And a key piece of learning from Harry Rutter, who is on the call, was Donella Meadows and adaptive complex systems and the influencing points. If you don't influence the way the rules of the game are played, you'll always be having suboptimal interventions. So for me, if I had to pick, it would be leverage points, and leverage points, maybe they're context specific, but it might be about how the finance gets allocated or links to outcomes. It might be about the governance process. It might be about defining the purpose of the thing. Why does X system exist? What's its purpose? It might be all of the above. And for me, those are far more impactful and influential, if somewhat less tangible and somewhat less easy to grapple with than specific interventions. But both do matter, but I'd have to go with leverage points on preference.
Great, thank you. And then moving on to the one that's very of the moment, how do you deal with sort of uncertainty and unexpected scenarios in this kind of work, both sort of impact of climate change or COVID or anything else that might be coming down the track?
Shall I go first? Yeah, I suppose. Yeah, the models we are creating, they're never going to be perfect representations of reality, but we need to. So there is a built-in sort of uncertainty into them. I don't think we can cater for any possible combination of external influences, but we can hopefully the models should be able to react to things when they do happen. And I suppose just from the pandemic, it's making it worse. But the situation in terms of inequality was there beforehand, and things we are doing, coming up with in the modelling to think about how we can reduce inequality were needed before the pandemic. They've just been made more obvious and wider, so there's even more need for us to do more as a result through this sort of work. So yeah, so it's something that we're aware of as modelers and as a team, but we can't cater for everything, but we'll try and make it as flexible as we can.
So I'll add to that. I'm not clever enough to be a modeler. But I'd add to that in terms of things will happen in any context, in any system. So it's important that we've got the modeling and the detailed quantitative stuff, and the conversation around the specific interventions, and the policy and the narrative pitched at not in the weeds at the very, very micro level, but at the meso and the macro level. So, and the meso and the macro level stuff just isn't going to change anytime in the foreseeable future. The micro level stuff will change, but before the pandemic, climate change was a thing. It's an even bigger thing now. So some of the big stuff isn't going to change. Poverty in economic context isn't going to, as broadly as it was 150 years ago, broadly as it was about 1,000 years ago, depressingly. So some of the meso and the macro stuff isn't going to change anytime in the immediate future. So it's probably important that we kind of stick at the right level so that we don't get kiboshed by changes in the very micro level stuff.
Great, thank you. And I guess sort of carrying on from that slightly, maybe a more specific question for you, Julian, is do you have sort of formal processes in place for updating the models as kind of new evidence comes up and kind of keep them current?
Yeah, well, I suppose all the models it's a fairly iterative process, creating models of taking the evidence we've got, testing it, trialing it, and then sort of calibrating it and refreshing it as new evidence comes in. And there will always be new evidence created that we would need to then sort of add in. So yeah, so we haven't got a formal process, I don't think, on that, but it's part of our general work to try and sort of iterate these models over time and keep them as up to date as we can.
Great, thank you. And then moving on, a couple of people asked about how you take people's actual lived experience into account in these kind of somewhat more quantitative approaches. So I wondered if you could talk a bit about that from the kind of modelling perspective, and then maybe also Greg from a kind of local authority.
Yeah, so from the modelling perspective, we've got the overall level. We've got the community panels which are reviewing our work and sort of sense checking that and checking the sort of makes sense to them for what they see in real life. But we also, I suppose, the other key bit where we're engaging with the public is on the valuation part of it. So that is talking to with individuals to get their personal preferences, but also not just what they think for themselves, but what they think society as a whole would benefit from, what the trade-offs for society. So that's quite an interesting aspect as well. It's the personal and the societal valuation that we're interested in.
For me to add, I've got 90 bosses, they're called councillors, and key is working out how we have a conversation in the language, the ordinary members of the public that happen to be elected as someone called a councillor. How do we frame what we're thinking in a way that they can understand, engage with, and fit it with their day-to-day lived reality? Simple, having conversations with them is the way to do that, because there's no point me talking modelling language to Councillor Lindis Hammond, who's the councillor for Walkley, because he doesn't use that language. So I've got to translate some of this stuff into the language that people do use, and that's just a simple having a conversation with people. And often there's a really interesting two-way dialogue there, which they'll come up with all sorts of insights that I just never thought of. So and that's a really helpful and insightful way to generate new ideas too.
Great, yeah, very important. And I guess this is quite a big one, but within the kind of relatively bleak picture that Greg painted of the sort of financial situation, what is the value of this kind of research approach? Do we have enough kind of ability to do different interventions at the moment, or is it just a kind of a wall footing which doesn't give us enough?
So I'll give Julian a break and I'll go first on this one. Was I only relatively bleak? I wasn't intending to be relatively bleak. I was intending to tell you like it is. Anyway, so to the answer, still valuable, still hugely valuable. Most of us are in the space of sort of managing an incredibly risky situation, and this kind of evidence helps us, but doesn't enable, let me get this right, helps enable us to make the right or the least bad choices when we're disinvesting in stuff rather than when we're investing in stuff. So you can flip it both ways round, and helps guide us make the kind of the right choices policy wise. There's a tricky thing, as I say, sometimes it's not about the evidence. Sometimes the evidence base just isn't in the right space at the right time. Sometimes it's about taking multiple bits of evidence and turning them into a coherent narrative, and it's more about belief than the hard evidence that X will lead to Y, but the evidence helps narrow the sort of the evidence versus belief gap. So, but that cuts both ways round, because in the space of investment and positive policy developments, the evidence helps in that context, but also in the sort of the converse space, this kind of evidence also helps in that context too.
Yeah, I think for me, it's just, as Greg said, we've got limited funding to do things with, but hopefully we can improve the use of evidence in those decision makers. We're never going to get 100% of decisions made purely on the evidence base, because people don't work like that. Politicians definitely don't work like that. So, but we can influence them by using the evidence with the relatively limited funds they've got at the moment, and the choices they can make. We can still have a difference by using this work.
Great, thank you. That was really helpful. And we haven't got a huge amount of time left, so I don't think we're going to be able to get to everything. But I just noticed one that I thought was interesting. Has there been anything in this project that has particularly surprised you?
So I'll go first. One of the things that's been really interesting is the ability of the policy partners to sort of that have research capability embedded with them. You know, clearly for us, Cipher has some embedded researcher. That is the totality of our research capability as an organisation. So, you know, the ability of local authorities to engage with research, be it this research project or any other research project, is exceptionally limited. And we'd never thought about that before we started down this path. Obviously, COVID has made it all much more difficult. We couldn't do anything about that. But there was wasn't a surprise, but the implications of it were sort of dawned on us a good way after. And if we want to get into this type of research as a sector, we as a sector need to think really hard about our basic research capability.
Yeah. suppose for me it was sort of, in some ways, the other side of the fence that was that surprised me is that the academics who are some of our engineers by background are not really looked at sort of social problems before, because they're looking at how we optimize car engines, for example, but they've been really keen to get involved in understanding these types of complex systems and how their expertise can help us with that decision making. So that's been really interesting for me.
Brilliant. Thank you both so much. I think we're going to have to wrap it up now, I'm afraid. So I'm very sorry to all the people whose questions we didn't get around to. And thank you very much for your engagement. And a huge thank you to both Greg and Julian for fantastic presentations today. I think it's been a great sort of demonstration of how to deal, or how to begin to deal with thinking about complexity and upstream determinants, and providing evidence for policymakers in a different ways. And we've talked about that a lot over the years, but kind of seeing that having some concrete examples of how you're trying to action that, it's been really fascinating. So best of luck with the next few years of the project. Look forward to seeing kind of what emerges. So that was all we were going to cover today on the topic of systems science. So I just wanted to highlight a couple of the other talks in this webinar series. So this is the second in the series, and we had one a few weeks ago, which was focusing on health and the early years. And you can now find the link hopefully in the chat. It's going to appear if you'd like to go back and watch that, if that wasn't something you were able to attend. And this meeting has also been recorded, and the link will also become available in due course. So I encourage you to listen back to that if you would like to. And then the next webinar will be on the commercial determinants of health and health inequalities on Wednesday, the 24th of November. And that's highlighting work from the Spectrum Research Consortium by Linda Bald, and then a keynote from Niamh Short, also from the Spectrum. And that will be chaired by Dave Crosby from Cancer Research UK, which is another of the UK PRP funders. So we do encourage you to sign up to that. And then there'll be another in the series after that, which the details will become available. So I think all that's left for me to do is to thank you all very much for coming. It's been fantastic to see such a big turnout, and to thank you again, Julian and Greg, for great talks. Thank you for your time.
No problem.
Bye, everyone.